Sumter Today is presented by the Sumter Opera House, USC Sumter, and Prisma Health.
I don't care if you're pushing a scalpel or a broom, people here, they understand that ultimately their job contributes to patient care. And that's something I'm really, really big on. Took that lesson from Disney in terms of everybody's got a character to play. And you know, as a result of that, in my career, I've gotten more notes from patients about how the housekeeper treated them, or you know, gave me a hug when I needed one, or passed me a tissue when I needed one. That's what I'm looking for. I'm looking for people who are willing to step up and step into a situation where they can really, you know, give back. And in a place like Tuomey, which is where I was in New Jersey too, community hospitals, you're going to see people that are your neighbors or your friends, people that you know, people that your family. And so it becomes very personal, and those people want to give back too. They want to be able to help, and so all we have to do is give them an opportunity to help. I feel like by getting to know people well enough, I can figure out, like, how do we change things? How do we find a job that's perfect for you? Because if I can get people to want to come to work, it makes life that much easier. And so that's kind of what gets me excited. And I could not do that for the 2 years of COVID. It was very difficult to connect with, even in the field hospitals that I was in setting them up, it was very difficult to connect with people because everyone was transient workers, everything was kind of contracted, and so I wasn't able to do what I love to do. That's what reminded me of why I like being in a hospital and why I like being able to kind of figure out how to solve problems. But I'm so lucky that every single person on that senior team here, whether it's the chief medical officer, the chief nursing officer, everybody, HR people, they all have, we're all singular in mind. We all realize that it's all about the patient. And so that was a gift. But beyond that, the things that I believe in is number one, you have to have a culture. It's a team culture. You have to be able to talk about the things that are good and the things that are bad. That was what it was like growing up in an Italian-Irish family. I mean, my dad would scream so loud, and he would talk about everything, and it didn't matter, you know, whether it was right or wrong. He just liked to have these crazy conversations about everything, from philosophy to politics to economics, you name it. And so I grew up in an environment where it's okay to call out your sister or your brother. It's okay to call out your dad. And that's an environment I've always been very respectful of. And so I want to make sure that in a hospital, it's like any business, any team I've ever been on, whether it was a football team or it was a hospital team, you have to be able to call out the things that work and the things that don't work, and you focus on the good stuff, and you get everybody to understand that, you know, we're all human, nobody's perfect, we all make mistakes. But I'm not going to beat you up for that reason. You know, I want to know how to make you better, how to make you happy about coming to work, and how you want to be talked to, so I can, you know, help you grow as a team. Like what we call a moonshot goal, like saying we want Tuomey to be the safest hospital in South Carolina. So I established a baseline to say this is what's important to me. I know we have to look at the bottom line. I understand the money's important, but right now we're only going to focus on the clear-cut quality stuff. So then we started these huddles, these morning safety huddles, where every department has to do a safety huddle, and then we all get together, and the whole department, every department is represented in this big conference room behind me. And we talk about what's right, what's not right. We take the day before as a lesson, and we figure out what went right, what didn't go right. And in a hospital, it can be anything from, you know, the toilets overflowing to somebody not showing up to work to a busload of kids coming in, you know, from a car accident or something like that. You have to be able to react. And the only way you do that is you make sure everybody understands what their job is and everybody understands where you go when you have trouble. I remember when Sully Sullenberger, the captain who landed that plane on the Hudson, I saw him speak one time, and he said that, you know, in that crew, the thing that was most amazing to him was everybody knew their job. He was a big safety advocate long before that happened. And he had never flown with the co-pilot there, and he didn't know the stewardess, he didn't know anybody, but everybody knew their job. So when they had this emergency, everybody knew what they were supposed to do. That's what I'm looking for here. That's what I'm trying to get here. And that's why we have these, now we have boards up, we put these whiteboards up, we have the same stats in every single department. Everybody's looking at what's important to them. So, you know, in the beginning they said, why are you doing this? Why are you wasting our time? We already know what's important. Yeah, well, you may know that because you go to the morning huddle. We don't have huddles during the day. We have several shift changes during the evening. So now when somebody comes in at midnight, they can look at that board and they'll see exactly what happened the day before, and that day they can see what's important, what's not important, and they'll know because it's all up there. And that's going to roll into what we're trying to achieve, which is called high reliability. A high reliability organization is one that is like the ultimate in healthcare. So I've done it at my previous hospitals, and that's why I know I'll do it here.
No one takes care of families like Prisma Health. As South Carolina's largest health system, we have nearly 600 primary care doctors across the Midlands and upstate, so you can choose the one who's right for you. With a more personalized approach, more locations, and more convenience, including 24/7 virtual urgent care and online or in-person visits with your primary care doctor, we're doing even more to help you be your healthiest you. Prisma Health, the primary care experts.